Across the country, more than 100,000 people are currently hospitalized with COVID-19. That's the highest number in 7 months.
And more than 2,100 of those patients are here in Indiana. The health department today reported 2,108 people in Indiana hospitals with COVID or suspected cases of COVID. That's the highest number since January 23rd. That increase in hospitalizations is putting a major strain on our healthcare systems here locally.
Most, if not all, major hospitals in our area have been on diversion at some point in the last week or two, meaning they didn't have the staff or the space to take on more patients. In fact, according to Indianapolis EMS, there was a period of about 8 hours this week during which all major hospitals in our area were on diversion. And when that happens, IEMS has someone act as a traffic controller. They monitor the types of calls and beds available and tell each ambulance which hospital to go to. This is being seen across the region as well. The president of Johnson Memorial Health says they've recently had to transfer patients from Franklin to as far away as Muncie to receive care.
We've been on diversion several days. In fact, as we speak, we're on critical care diversion right now. Our ICU, and again, we have a smaller ICU, but we have 6 patients in the ICU now, 3 on ventilators, 2 other, not doing well from a respiratory standpoint. And that's high intensity nursing that's needed. And, as we've talked about, there's a shortage of nurses, especially, critical care nursing.
And that is why health leaders say the state's COVID-19 dashboard showing around a quarter of ICU beds available statewide can be misleading. There is a staffing shortage all across the healthcare industry. So just because beds are available, that does not mean there are enough nurses to care for the people who need those beds. We spoke with Dr. Ram Yaletti with Community Health about these numbers.
It could be a little misleading to think, things are okay out there because things are really, really tight. The total number of patients in our hospitals is much higher now than it was last year for the previous surges. So there's just more people sick. And there are more COVID patients that are sick, and we have less nurses. So all 3 of them together is just this perfect storm, which is really putting a strain on everybody.
The president of Johnson Memorial says they have the highest number of COVID-19 patients right now since the vaccine became available to the public. Community Health currently has about 150 COVID patients compared to just 20 in the spring. Both say the vast majority are unvaccinated.
Here's another snapshot to give you a better idea of the increasing number of COVID patients in local hospitals. We're going to focus on 2 IU Health hospitals in Indianapolis, Methodist and University, and give you a weekly comparison. Take a look at these numbers. A combined 112 people with COVID were hospitalized in Methodist and University hospitals yesterday, August 25th. 87 were unvaccinated, 25 were vaccinated. Of the 40 people in the ICU, 32 were unvaccinated, and of the 24 people on a ventilator, 19 were unvaccinated. The 5 who were vaccinated are considered immunocompromised. Now compare that to 1 week earlier, Wednesday, August 18th. At that time, 74 people were hospitalized with COVID between the 2 hospitals. That's an increase of 38 people from week to week. 61 were unvaccinated and 13 were vaccinated. Of the 30 in the ICU, 27 were unvaccinated, and all 18 people on a ventilator were unvaccinated.